going to do them briefly, two to offer and withdraw, and start with accelerated drug approval for prescription therapies with Senator Paul. We've worked on this for some time. It would establish an accelerated approval pathway for drugs that are already approved in foreign countries with comparable regulatory agencies. Today, we're preparing for future emergencies. It only makes sense to have an expedited drug review process for safe and effective countermeasures that are already approved in developed countries. Our amendment would increase access to safe and effective drugs for Americans and drive down costs by increasing competition. Recognize that we do need to come to more of an agreement on this. Appreciate the fact that you're willing to discuss it. Withdraw it at this time, and hopefully we'll get to it here down the road.
This is an important amendment, and I do look forward to, we're going to be doing other legislation on prescription drugs. Let's see if we can work on this and deal with some of the problems in it.
Thank you, Mr. Chairman. Amendment number 2. This is with Senator Budd. During the COVID-19 pandemic, Americans saw government flourish while many of our constitutional rights were diminished. More and more, big government wants to turn everything into a national emergency. Recently, the Secretary of Health and Human Services stated that gun violence is a public health emergency. This would give HHS the ability to restrict Americans' right to keep and bear arms. HHS was never intended to implement gun control of any kind. My amendment with Senator Budd would simply prohibit HHS from declaring a public health emergency to implement gun control. And I am requesting a vote on this one.
Okay. Thank you. In my view, it is critical that we protect the authority of the Secretary of HHS to declare public health emergencies based on science and evidence. And this would be, I think, an unfortunate precedent, and I would urge my colleagues to vote no on this amendment. Senator Cassidy.
We've got a public safety issue. We absolutely want to reduce the incidence of gun violence. We need to give additional support to law enforcement. We've passed the Safer Communities Act on a bipartisan basis. But what we're talking about here is abuse of public health emergency powers. And if we continue to overuse, for the sake of expediency, something which is intended to be only for emergencies, not as in, my gosh, we've got a baseline of issues that we're addressing in a variety of ways, but no, because in an effort to kind of satisfy a political itch, the president's going to declare this an emergency. We're going to undermine support for the presidency, for the government, and for the concept of a public health emergency. I think this amendment's good. It addresses misuse of emergency powers by the president. If everything's an emergency, nothing is an emergency.
Further discussion? Senator Braun, you had another amendment?
Yes, I do. Thank you. This is with Senator Hassan. It's the equitable distribution of emergency medical countermeasures. I've worked extensively with her office and consulted with ASPR, getting their support as well. Additionally, my staff has worked with stakeholders to resolve any concerns with this amendment. It would ensure that HHS uses public health data when deciding how to allocate medical countermeasures during an emergency. It would also make public the data used to make an allocation decision alongside a brief justification for the allocation. Everyone can agree that Americans deserve transparency into the decisions that HHS makes during public health emergencies. Chairman Sanders and Ranking Member Cassidy, I appreciate the collaboration from your staff on this as well. I will withdraw it, but I would like to request a commitment from both of you to Senator Hassan and me that you'll continue to work with us on this bipartisan, common sense concept going forward.
You got it.
Likewise.
Thank you.